Hi, everyone. It's Anne from Womaness, and I am thrilled today to be speaking with Dr. Anita Sadatay, as well as Michelle Jacobs, our co-founder at Womaness. Welcome, ladies.
Thanks for having us, Anne.
Oh,
Thank
I'm
you. Very excited.
very excited. Dr. Sadaty has joined us at Womaness as a newly appointed medical advisor. She's a trailblazer in women's health, and she combines her medical training with something called functional medicine, which is a philosophy of medical care that really looks at the root cause of symptoms and diseases. We are really excited to dive deep into this topic.
Wonderful. I'm excited to share about it.
Great.
So,
One of the things that I'm excited to learn about, and one of the things I'd love to hear about, is just sort of your background and how you ended up in functional medicine. But like, what is the path that got you here?
So as you know, Michelle, I was doing straight ahead conventional OBGYN, tons of deliveries, seeing a lot of patients, a lot of surgery. And I definitely wasn't happy really doing that because I just didn't think it was very personalized. You didn't have time with patients. It started to feel like a Band-Aid approach kind of thing.
Mhm.
What's interesting is that my father, who is originally from Iran, he's a retired pediatrician, and he himself, I think, just because of his medical background originally, was diving deep into more integrative, holistic approaches. And every time I visited him and my parents in Florida, they would be like, magnesium's really good for sleep and anxiety. And blood sugar balancing is good for PCOS. Like he just would throw these. I'm like, okay, Dad.
Yeah.
And then one night, I just fell into, he sort of mentioned these kind of trailblazers in integrative medicine, and I on it spontaneously just decided to do a course. And so I started learning about functional medicine on an online course, and I started just sort of using it on my patients and it was working. And I was like, what? And
Yeah.
so all of a sudden I realized, once you start seeing how powerful uh, lifestyle medicine is, nutrition, taking out things that are inflaming you and negative for you, addressing sleep disorder, balancing patients with supplements that don't have negative side effects and consequences and are potentially short term, depending on what you're trying to fix. I just couldn't really in good conscience go back to just practicing sort of pharmaceutical medicine where it's very helpful for symptom control, but it doesn't necessarily say, well, this is why you feel this way, and
Hmm.
let's try to figure that out, and let's try to eradicate whatever it is that's triggering these problems.
Hmm.
So yeah.
That's great. But when a patient comes to see you, what would be different about going to see you versus a more traditional doctor today?
So I can give you a really sort of real world example. Let's say that I have a patient who comes in because they're experiencing a lot of PMS issues, or they're having period concerns, pain,
Mhm.
long periods, heavy periods, something like that. Um, Classically, what I would have done in the past is I would check a pelvic sonogram to make sure that they don't have structural causes of bleeding disorders.
Mhm.
Maybe I might check some basic hormone panels, although the range of normal on blood work comes back very broadly. So it doesn't, most of the time, doctors are like, you're normal, even though you're not. And then I'd say, you know what, we can put you on a birth control pill. That's it. What I would do now is I would sort of first of all do very precision hormone timed blood tests to see what their estrogen and progesterone levels are with relationship to each other, as well as looking at other things like nutrient levels, like for example vitamin D, highly associated with heavy painful periods when it's low, just as an example. um, I would ask them about what their diet looks like. Are they not really eating a lot of vegetables? Are they not eating enough protein? Do they have a lot of processed food? What is their sleep pattern like? What is their stress level about? Because all of that ends up impacting their estrogen and progesterone and how they experience their period? Do you have intestinal issues? Because if your gut is not right, the way you process your hormones is not right. So like I'm looking for all the reasons why. And
Yeah.
then I try to steer them in the direction of supplement support with lifestyle change, because to me, I feel like that's addressing the root cause. And then, in a last resort, or not even, if the patient is not ready for that kind of approach, like that's just not, they don't necessarily want to make changes, then I can offer classic things that are going to just immediately give you symptom relief.
Yeah.
But that's the difference. Like we're looking for why.
Wow.
That's really interesting. I had that I about a year ago, and I'm in menopause now, but I was bleeding for about 4 months straight. No, I'm
Wow.
not kidding. And I was scared, and I went to my doctor. He just ran a blood test, like you said, did an internal exam, ruled out anything scary, and then just put me on the birth control pill,
Hmm.
which
Hmm.
for me, it actually did work. It didn't answer the questions of why is this happening to me,
Hmm.
besides so many of the things that you're talking about. But there are a lot of women out there that come to us at Womeness and say, I don't know that I want to go on the birth control pill. I don't know that that's a great idea for me. Like, I'm
Hmm.
scared to take it. Are there,
Hmm.
side effects, long-term things that can happen from taking the birth control pill? And so
Hmm.
to know that there's a better approach,
Or,
a
yeah.
more whole approach is great.
Yeah.
Yeah.
I mean, it's definitely been an interesting road that we've been down with Womaness. I mean, there's so many, we have women who are put on HRT even if it's working for them, they still have questions about it, to
Hmm.
the other end of the spectrum where people have no idea what's going on at all. And I mean, just from hearing from, our customers, our community members for so long, it feels like there should be some middle ground, or at least some explanation about what's going on.
Yeah.
And to me, that feels like the thing that's still missing out there. I think there are more options for women, but definitely getting to that root cause,
Hmm.
because there's so many symptoms related to perimenopause and menopause
Hmm.
that, you're like, why is my hair weird and I'm having a painful period? Like what are, those are two very different things, but the root cause could be the same.
And it's
So
an
it's,
individual thing.
yeah,
What's
Yeah.
right for me isn't right for you, Michelle, and it's not right for my friend. Like, everybody's very, very different.
Yeah.
There's not a one size fits all.
I do have a question about supplements though. There's so much out there, and
Hmm.
there's, a lot of, I hear criticism of supplements. They don't work, or they're overpromising, the claims aren't right. And again, on the other side, this, like, they're cure-alls, it's going to change your life, you need to be on 50 different things to
Right.
go. How do you figure out, and I'm talking about the person that doesn't have access to a doctor like you
Hmm.
know, what are the basics that you should know about taking a supplement, and how do you know what supplement to take?
So that's a great question, because I often come into patients who don't necessarily see me as a functional medicine doctor, but just a regular gynecologist. And I often get this question because everybody thinks, I'm like a supplement guru, but they'll say, "What do you think about da da da?" What do you
Yeah.
think about? And because there's with social media and the access that we have to information and the advertising dollars, it sounds like you should be on 1,000 different things. They were going to give you the fountain of youth kind of thing, and cure alls, like you said. So I think that the approach should be a little more measured and conservative, because you want to see, first of all, if what you're taking is making a difference for you. I can tell you right now that when I start supporting patients with the basics, for example, something like magnesium,
Mhm.
which I do truly think that most people should be taking magnesium, just as a general rule of thumb, because we are incredibly deficient in that mineral, and it affects 300 or 400 different biochemical reactions in our body. And there are different forms of magnesium that can do different things. So, without getting that complicated about it, you don't even have to know that necessarily, because they'll all sort of do something helpful in that regard. But I think that if we look at the foundations, like basic deficiencies of things like vitamin D, magnesium, fish oil, for example. Those are things that I think everybody probably should consider trying, or even checking blood tests to see if you need those things, if you had to be convinced.
Yeah.
And then, so there's foundational things. Then there's problem solving things. And that's where I think you have to now trust the brand a little bit, that they've done their research, that
Yeah.
they're using quality ingredients, that they know what kind of supplements, ingredients synergize together to produce a given result.
Yeah.
And so that's why, for example, if someone says, I got my fish oil at Costco, I don't necessarily know that that brand, and it may be good. Like, to me, I haven't done the research in it because I'm a little suspicious of bulk production. I don't know that there's so much care there. So I sort of like companies that are a little more boutiquey. They're either specializing in a particular arena, or they just have a history of taking care with what they're putting into their stuff.
Yeah.
So that's a second caveat. So there's foundational stuff, there's problem solving, there's brand recognition and trust.
Mm-hmm.
And then there's just understanding, like, do I feel a benefit with this? And knowing, am I using this in the right way? Am I using it long enough? So
Yeah.
sometimes patients will say to me, I used that X that you told me to take. It didn't do anything. I finished the bottle, didn't do anything. I said, well, remember how I said it takes 3 cycles?
Yeah.
Like you might need. So there's that information. So I would say that for example, your company, Womaness, when I looked, before we even met, and I looked at your platform, I loved how you laid out the ingredients, the thought process behind it,
Mm.
how it works together, what is it trying to address.
Mm-hmm.
This is essentially, that's what you want to look for. The way you laid it out educationally is ideal. I wish that that's how companies would do it. And there's no over promising there. I mean, there was research behind what you're saying is happening. So, so those are kind of key elements that I think are very helpful if someone's shopping around for
Yeah, I
supplements.
just to add to that, being on the business side of creating supplements, it is tricky out there. There's a lot of ingredient companies, there's a lot of supplement companies, and our approach was to go very small. Like, let's focus on companies we know, ingredients that have good clinical data, and like almost dip our toe in the water, see how it's going, see how it's working, and then expand from there. But there is a lot of pressure on companies to, reduce price, and
Yeah.
reduce price means reduce quality. So when
Yes.
you look at a supplement like ours is $46. It's not, we're like, ugh, I wish we didn't have to charge that, but the ingredients are very high quality, very expensive, and that's what makes that happen. So it's also like, if you pick up, for me, I having done this for a while now, when I pick up a supplement that's $4, I would think twice, because I know what this stuff costs.
Yeah.
But unfortunately, some of these ingredients are expensive.
Yeah.
Um,
Yeah.
yeah, so that's sort of a tricky thing on the business side of how do you do this and make it affordable.
I mean, I have to say that I know the companies that you work with, and they're
Mhm.
all, top quality, which I'm really excited about.
Me too.
But I also, I think that you guys, because I know how much supplements cost that are effective and
Mhm.
that work. And I think you guys, even though the price point is higher than what most most people are going to recognize if they go to, a drugstore and they see sort of the generic brand, I think that you guys are incredibly moderately priced, for what you're getting. It's a bargain. It really is. I understand. I do feel it's hard,
Mm.
because patients have to pay out of pocket for so many different things, but this is what works, and that's what's going to help you in the long run. And it's going to be good for you, and you're not going to have side effects, and you're going to feel different. Like, you just have to sort of prioritize that my health is important and it's more important than going out for that $300 dinner,
Yeah.
or whatever, once a month,
Coffee.
something. Yeah.
Are there certain symptoms of, perimenopause and menopause that are more likely to recommend supplements versus hormone replacement therapy? Like if a patient comes to you, is there certain symptoms that you're like, you really should go right to hormone replacement versus
Mhm.
starting with supplements? Or again, how do you think about that?
So perimenopause is it's a really complicated time because it can last for anywhere from 2 to 10 years before you actually go into menopause. So technically, it could start as early as your late 30s, potentially. The 40s is sort of, I think, by definition, a perimenopausal time. But what's complicated about it is that the hormonal fluctuations that are experienced are incredibly varied. So one woman may have the hormonal pattern that looks like estrogen dominance, where they're making far more estrogen than they're making progesterone. And so that imbalance can express itself in a particular way, such as more severe PMS or breast tenderness or heavy clotty periods, or um, periods that are closer together than they usually were, let's say, or water retention, that kind, mood instability. So that could be an estrogen dominant perimenopause pattern versus someone who is experiencing hot flashes or night sweats or vaginal dryness and no periods for a while, then punctuated with this crazy period that lasts for 3 weeks. So that woman is expressing a more estrogen deficient kind of prototype, right? So it varies, and the answer is that from month to month, week to week, day to day, you could see variation.
Hmm.
So it becomes a little tricky to actually use uh, typical hormone replacement therapy for that person, because one day they may be estrogen dominant, another day they may be estrogen deficient, another day they may be testosterone deficient. It's so variable. So to stick somebody on a hormone replacement when you're giving them more estrogen, but on that day they're making too much, it's complicated. So the order of operations for me in perimenopause is lifestyles first, specifically nutrition, specifically looking to balance blood sugar and optimize protein. So that's sort of really number one. That helps a lot of hormonal instability. The second is trying to optimize sleep patterns. The third is managing stress. So if our stress hormones are very out of control, our hormone expression is crazy. That's when you can get really horrible hot flashes and night sweats and hot flashes, which then leads to terrible insomnia, which then leads to brain fog and cognitive, imbalance, which leads to moodiness, anxiety, and depression. Like, it's really a slippery slope. So I try to see, how do we optimize those from a lifestyle perspective. The second is looking at certain supplements that are more about balance. They're about adapting to the current hormonal situation. And in Ayurvedic medicine, there are a lot of herbal formulas that are very helpful in that regard. So what that means is that if you're estrogen dominant one day or estrogen deficient the other, or progesterone deficient one day and not necessarily progesterone dominant, but not balanced there, an Ayurvedic adaptogenic formula brings you back to balance. I don't even know how that works. I really don't. I've been using these formulas for years, and it's so interesting to me that there are herbal formulas that can do this. That
When
if
you
you're stressed,
just so for people who don't know, when you talk about the ingredients involved in Ayurvedic medicine,
yeah.
what is some of those? Like, what would people be looking for?
So specifically, you would want to look for ashwagandha.
Mhm.
So that is a stress hormone stabilizing adaptogenic formula. And what that means is, if you're, let's say, producing too much cortisol or adrenaline, that will bring you back to more of a medium balance. If you're producing too little, it can help support you. So people that have low cortisol, low adrenaline, they feel like completely burned out, no energy, flatlined, could take a nap at any moment, that kind of thing, versus a person who is wired, constantly going, can't shut off their mind, almost just like uh, manic, could be
Yeah.
even. So ashwagandha is something that will bring you back into balance.
Okay.
And when your stress hormone, so one of the biggest underlying causes of things like hot flashes and night sweats and things like that are stress hormone instabilities. So if you have an Ayurvedic herb like ashwagandha, for example, that will help stabilize, and that can help potentially reduce things like hot flashes and night sweats and
Mm.
insomnia. It also has benefits as far as mood and anxiety and sleep. Another formula that I really like is Bacopa. So that one has more cognitive benefits. It's helpful for focus and concentration. It can help get rid of brain fog. I mean, a lot of women report in perimenopause that they're just not as sharp. They're more
Mhm.
forgetful. It's almost like I'm afraid I'm developing dementia. Like what's happening here? And Bacopa has been shown to be incredibly helpful and um, can synergize with
Mm.
things like ashwagandha. Um, for women that are really struggling with the more estrogen deficient symptoms, that's where something like a powerful antioxidant like pycnogenol is very helpful. So that's an antioxidant formula that has many benefits for perimenopause and menopause, actually. In addition to helping those vasomotor symptoms like hot flashes, night sweats, and insomnia, it can help cognition. It can help reduce cardiovascular disease as an antioxidant. It's a free radical stabilizer. So these free radicals are things that we produce when there's injury or aging. So it can sort of sequester these free radicals from damaging your body and creating heart disease.
Mhm.
The other thing is it can help with bone health.
Okay.
So these products are so powerful because they have wide-ranging, comprehensive benefits.
Mhm. Well, I appreciate you mentioning those three ingredients because they are in our menopause supplement. I know you didn't do that necessarily purposely, but it is
That's great that they're
widespread.
all together because
Yeah,
a lot of times patients have had to take them all separately, which is
yeah,
costly and annoying. You know what I mean? It's a
yeah.
lot
And
of pill fatigue.
it is why we decide, those are the three ingredients we chose purposely. So thank you for mentioning them. But there's a reason, they are the best ones from my perspective on, how to manage the most symptoms in one without taking too many things. I'm going to change directions for a second and ask about libido because that is like a huge. I always say to Anne, like, and Anne, this too, our customers will come to us and like be talking about one thing and eventually it gets to, oh, my libido's down, I have no sex drive, I hate my husband, or I like my husband, but I don't want to have sex with him,
He hates
Right.
me.
or my partner, whatever it is. So I'm just curious, why is this such a widespread issue? And is there something again that you would recommend? Or how do is this just part of what happens, or is there really something you could do about it?
Well, I think we've all expand. This is gonna be relevant when I explain what I think the different forces are behind the reduced libido issue, which is really problematic. It's very widespread.
Mhm.
It's huge in perimenopause, and it's very frustrating because even if you don't necessarily hate your husband and you like your husband, you'd rather read a book and watch TV at night.
Mhm.
That is a very, very common thread, in
Yeah.
terms of complaints and concerns. I think a lot of women have had the experience that when they go on vacation, for example, all else being equal, you're more willing to have sex. Okay. And one of the compounding pharmacists that I've worked with many years ago used to use this quote, which I thought was really right on the money, that Men have sex to relax, and women have to be relaxed to have sex.
Mhm.
So putting aside hormonal shifts, which are very important, right?
Yeah.
I mean, low estrogen, low progesterone, low testosterone, these are all things that start to happen in perimenopause and menopause, and they are hugely related to libido. For some women, replacing those hormones, all of them, the estrogen, progesterone, testosterone, do wonders for libido. So that's certainly you can't, but it's not the full story.
Mhm.
Okay. The other part of the story is the stress piece. So for example, some of the things that we talked about, like an ashwagandha, like magnesium, like magnolia, that's another, stress reducing herb. Those things can actually impact libido only because your stress levels become better when you use them. The third piece is, are women having pain when they're having sex at this point? And therefore, that obviously becomes a huge turnoff.
Right.
So if you're vaginally starting to experience less blood flow, vaginal dryness, less sensation, frank pain, then you're of course not going to want to have sex. Like the interest will
Right.
be gone when the expectation is, when I do this, I'm going to be in pain, or I'm not really going to feel anything.
Yeah. And it's really common. That's a really
Incredibly common. So that's always actually one of my first questions are you experiencing pain or discomfort when you
common.
have sex? Because if that's the case, of course you're not going to want to have sex.
Yeah.
How stressed are you? Let's talk about that, because if you have a full-time job and then you're coming home to your second job and you're getting 6 hours of sleep a night,
Right.
and you have these deadlines, and sex is just not going to be on the agenda. It's not on the to-do list.
Right.
Right. So then of course the hormonal piece is important. If someone is super deficient, all the receptors, for both brain and the genital tissue, if they're not getting the appropriate hormonal stimulation, that's not going to be great for libido either. So those are sort of the big categories that I look at.
Yeah. And in terms of treatment, um, is there obviously the stress and the lack of sleep, that's one set of treatment. But if you have literally a functional, like structural issue, I don't know what to
Yes.
call it, but like a blood
Yeah.
flow issue, I mean, what would you recommend at that point?
So if we're looking to address the vaginal tissue, there's sort of a stepwise approach. Number one is you want to try to rehabilitate the tissue a little bit, rehydrate it, improve moisture status, things like that. So a lot of women will start with some non-hormonal therapies. I'm not a huge fan of some of the available over-the-counter moisturizers, only because the ingredients are not great. They're not clean, and we absorb a lot of whatever is in these um, chemical formulations. We absorb a lot of that from the vagina into the bloodstream.
Mhm.
So I want to be very careful about that. So I've always in the past, I used to have patients use compounded vaginal moisturizers, like they include things like hyaluronic acid or vitamin E, or they have coconut oil. They're more natural formulations. And the key ingredient, like hyaluronic acid, is really helpful because that plumps up the vaginal tissue. It increases moisture retention, and
Yep.
therefore the tissue becomes more elastic, more lubricated, and there's better sensation. So that would be sort of level one. The
Yep.
second would be using something hormonal vaginally, so a topical formulation, and that can be an estradiol cream, an estradiol tablet for women that are not comfortable, let's say, using hormones systemically. I try to reassure them that for most women, this is reasonable. In some cases, you may even want to avoid anything hormonal, but
Mhm.
um, most women can use a vaginal estradiol formulation of cream, or a tablet, or You can use DHEA, which is another adrenal hormone that can convert to estrogen intracellularly in the vaginal tissue. So there are formulations. These are prescriptions, either available at a regular conventional pharmacy or compounded. And then the third option would be doing treatment with a vaginal device, something like a vaginal CO2 laser or a vaginal radiofrequency device. This is definitely for the woman who does not want to be applying goos and pills and stuff at night, or, whatever. They just they're not interested in that. Or they need something a little more intense to fix what's going on with their tissue. And that these treatments are nice because it's sort of like you do 3 sessions and then you do one a year to maintain. And that helps to keep the collagen, the elastin, the blood flow. So those are my 3 levels of, intervention there. And they're all very successful, by the way. It's just sort of individual responsiveness and desire,
Yeah. One other, back to the supplements, I had another question. I'm sorry, I could do this all day.
Yeah.
Why is there not more formal research on supplements? Like, it feels like, you get a prescription drug and you get, this laundry list of things, and it's registered with the FDA, and all this, supposed data to make it says that it's safe and does what it's supposed to do. I mean, that's a whole other conversation.
Yeah.
But why don't we have that with supplements, especially ones that have such great history and have a lot of people using them? Like, it feels like you should have some sort of like way to say this is this is proven, this is clinical data, the same way you would look at a prescription drug. Why do you know why that is different?
I mean, I hate to say it, it's really financial. It takes a lot of money to finance research studies in order to prove that particular substances are successful in terms of clinical treatment. And because supplements are natural, and hormones for that matter, for the most part, they're natural substances, there's no way you could get a patent, and you can't really get exaggerated amounts of money for that product. So yes, there's a level of, the research and development dollars are high, but the return on investment for a drug that is FDA approved and hits the market is, it's huge. That is not the case with a supplement. You're not going to make a lot of money selling a supplement because you don't have a patent on it. So, and unfortunately, most of these supplement companies don't have the kind of money to necessarily invest in that way. Now, some do. There are some companies that will run it, but it kind of comes down to dollars and cents. The second reason that we're not aware of it is because the majority of medicine is allopathic medicine. So that's your typical MD, your medical doctor, or even now osteopathic physicians, the DO. They have moved to a much more pharmaceutical model of care than used to be. And so because that is the way medicine is essentially practiced in the United States, medical schools are subsidized by pharmaceutical companies. And so that's the kind of medicine that doctors are taught. And so they're not aware of alternatives. So that they're not going to offer that because they're not aware of it. So so it becomes sort of a vicious cycle. If your doctor isn't aware of it, they're very suspicious of it. They don't think that there's good data behind it. They don't know that there's clinical benefit because there aren't a lot of research studies that are going to hit the typical medical publications and journals. So they're unaware, and therefore they're not going to offer it to you. They are aware of pharmaceutical medications, so that's what they're going to offer you.
I mean, it's so interesting, and it's unfortunate because in many cases supplements don't have the side effects. They're in some cases less expensive. You can still use your FSA dollars in some cases to cover the cost. And you still have so many people skeptical because it doesn't have that prescription sort of label on it.
Well, what is so interesting is that you mentioned about, FDA approval.
Mm-hmm.
So this is like classically what some patients will say to me, this isn't FDA approved, or other physicians say things like that.
Mm-hmm.
And I said, well, you do understand that the FDA is approving pharmaceutical chemical drugs because there's no known safety profile for those.
Right.
There's no need to FDA approve vitamin D.
Yeah.
It's a natural substance. It doesn't require drug approval.
Mm.
And that's why supplements are not FDA approved. They're not drugs.
Right.
That's like
Right.
saying, this head of lettuce is not FDA approved. Well, because it's not a drug,
Right.
So FDA approval is a way that some physicians who sort of are almost anti-supplement because they're not aware of it. That's their way of trying to scare patients away from it. But understand, it's not a drug. It doesn't require FDA approval.
Right.
This
Right.
isn't a dangerous chemical that's been synthesized in the lab that has to go through a rigorous approval process because we have no idea how it's going to affect your body versus magnesium.
Yeah. Yeah.
So that's why.
That's so unfortunate in so many ways, but yeah, I mean, it's unfortunate, but it really requires you to do a little bit of your own research to understand what it is that you're ingesting, what it is that you're taking, what is the origin of that, so you can feel more comfortable. But yeah, like I often wish there was some stamp of approval that says like, yes, this is good, because we get just so much skepticism from people, and understandably so. But I just wish there was like a, some body that would say this is good, because otherwise there's just so many options out there.
That would be great,
Yeah.
to have an unbiased, objective,
Yeah.
organization that can go through the literature and the clinical, the available clinical data. I mean, I have to tell you, listen, if you were to Google, any particular supplement, let's say ashwagandha or something
Yeah.
like that, and it takes you to a database, like a scientific database, which it will, especially if you write studies on ashwagandha,
Yeah.
right? Or scientific studies. It will take you to the database of what's available, what has been studied, because there are people studying this,
Yeah.
and
Yeah.
it will tell you what the available data is. So you could do that with anything and just go to the research.
Yeah.
It's doable. It's easy
I
nowadays.
know on our website we list the appropriate studies for the ingredients that we
Mhm.
use for that reason. So if someone says, well, I don't know, is there clinical data here? We can point them to the place. Yes,
That's
Google
wonderful.
this study. This is why we use this ingredient at this level, and this is why we can make this claim.
That's
So,
amazing.
we do that. I know we have a few minutes left, and Anna, my last question is one that's near and dear to both of us, just about weight gain and what happens. Why is it so hard to lose weight? Why do we gain
Yeah.
weight?
Mhm.
And the thing that is, there's a lot of news right now about supplements that claim to be GLP-1, ingredients,
Agonists,
and
yeah.
yeah, and is there anything to that? And Anne, if you want to add anything to that, because I know we were literally talking about this before the call started.
Yeah, it's something that, and it's something that our customer comes and asks us about a lot. Like, what am I supposed to do with this midsection? How do I get rid of it? There's all of these weight loss options out there
Mhm.
now. Are they good for that? Even with the menopause, like, is that even going to help me, or is it going to make it worse? Um, it's, there's a lot out there, and there's a lot of questions.
Yeah.
And
Well, I'm sorry, continue. What'd you
I
say?
said, and I hate it. It's
Yeah. Well, here's the thing. It's a, um, there are several things at play right now. So first of all, just generally, men and women, as we age, there is a close to every decade, there's a 10% decline in your muscle mass.
Mm.
So that's just an aging phenomena. When your muscle mass goes down, your metabolism goes down. Your muscle is your most metabolically active tissue. And so the less muscle you go into menopause with, the more trouble you're going to have. So there's just general aging there. Then there is definitely lack of hormones. So when you lose estrogen and progesterone and testosterone, you end up becoming more insulin resistant. So insulin, which we all think about as, well, I need that to lower my blood sugar, or if, if diabetic has issues with that, insulin is a growth hormone. It makes tissue grow, including fat. So if your insulin levels go up, then fat deposition goes up, and insulin related fat is typically around the middle. So is stress related fat. Now, it's interesting because that has a correlate with insulin. Because if your cortisol levels, which are your main workhorse stress hormone, if that goes up, your blood sugar goes up, so your insulin goes up. So that's all of that sort of conspires to create, 10 extra pounds that you can't get rid of no matter what you do. So the ugly truth is that the way we did things in our 30s and even our 40s to lose weight will no longer work now. And that's because our tolerance of foods that raise insulin go down tremendously. And it's worse if you're not on hormone replacement. So hormone replacement, there are plenty of studies that show that women on hormone replacement gain less weight over time than women who are not. That's clear. I will tell you that generally in my experience, putting someone on hormone replacement therapy alone does not fix weight gain. It may stabilize it, but it's not the magic bullet that even the studies seem to say. Like if you go on hormone replacement, you can stabilize weight or you may even lose weight. I do have a handful of patients that will lose a few pounds having been on hormone, which is great. It's better than nothing.
They just feel better and they're sleeping better and it's allowing them to exercise.
There could be so many other spokes to that wheel. Yeah. If you're sleeping better, your weight's going to be better. That's certainly true. And if you're more energized, you're not going to have emotional eating, or your eating patterns be different. There's so many ways that works, but the other one is testosterone deficiency, which is not always included in hormone replacement. So if testosterone goes down, our ability to put on muscle mass goes down. So our ability to burn calories goes down. So, all of that is part of it. And then there are all the other reasons that women can gain weight, like toxic overload, stress hormone imbalance, adrenal hormone imbalance, testosterone deficiency. We talked about excess cortisol or too little cortisol. So, all the thyroid hypofunction. So there's all the things. And the thyroid gland also gets affected by hormone changes. So it doesn't work as effectively if you don't have estrogen and progesterone. So there's so many ways that it kind of comes together. But the bottom line, and just as like quick little takeaways for that, number one is please prioritize strength training over any other kind of training. So cardio is fine. It's not going to help you lose weight. Good for heart health, not good for weight loss. Strength training, build the muscle, that will help. Number two, prioritize protein intake. If you're not hitting at least 30 grams of protein per meal, you're not getting enough protein to balance your sugar and insulin. The third thing, as you just mentioned, Michelle, is get enough sleep. Right. And then try to balance all of your hormones as much as possible. So, it's not easy. It's not easy. It's not easy. And I have to tell you that there's a new theory about weight gain in terms of the brain having a set point shift. Once you've gained the weight, your brain sort of sets your set point for where it wants your weight to be higher. And then it becomes even harder to lose weight, which is really why these GLP, these medications are so successful, because it overcomes set point problems.
It's that idea of like you've lost the same 10 pounds over and over again. Like, like I get so excited, I lose the 10 pounds and literally like 3 months later, it's back. No, even if I'm doing the same things, it comes back. And it's infuriating and it drives me crazy. But that's that idea of like your body is going to always go back to that set point. I mean, I'm almost glad you just said that out loud, because sometimes you just think you're crazy and you feel, unfortunately, you sometimes feel like a failure. Like, why can't I keep the weight off? Why can't I control my eating? But it's your body working against you.
Oh yeah, your brain is doing everything it can to get you back to that higher weight. Because listen, we've been around unlimited food for a minute in human history,
Mm,
right? So we haven't had a chance
yeah.
to adapt to this constant presence of highly processed food.
Yeah.
And, in the past, all of the evolutionary adaptations were about trying to keep on fat because famine was the problem. So if your body uh, got to a certain weight that was higher than normal, then it's going to do everything it can to stay there because that's a survival benefit. Not now, but it was, thousands of years ago. So yeah, your body's fighting you for it. And that's honestly, I think, why for so many people, the Ozempics and the Manjaros and stuff are their answer because it does overcome a set point issue. Now, I have problems with patients that don't look under the hood for other reasons, inflammation, toxins, hormone imbalance, stress imbalance. Like, please, like gut issues, like, please correct these things before you go on to
Yeah.
medication,
Yeah.
but yeah.
Oh my gosh. This is so great. You are so great. I can literally ask you, I could go on, but I know that we have a set time. But this has been amazing. And I think we're just so lucky to have somebody with your range of information and knowledge on board with Womaness. So I can't thank you enough for this time. And did you have any, I'm sorry, I like co-opted your
And
interview.
this, like you said, we could literally do this all day long. Michelle and I are both in the throes of
Ugh,
menopause. We have all the symptoms that everybody else suffer from. I have anxiety. I can't go to bed at night because I know I'm going to have hot flashes and the night sweats
Mm.
all night long. I change all night long. But there are things out there that can help you, and you're not alone. You're not alone. That's the biggest thing we want people to take away from this.
yeah,
Not alone.
we're all confused and we all want more information.
Yeah.
Thank goodness you guys are putting it out there. I really applaud your efforts and everything that you're doing for women in this country, to get past this. It's a struggle,
Yeah,
and thankfully it's really being spotlighted right now, which is great.
great. Well, thank you.
Thank you so
And
much for your
Thank
time.